HCD TV from the publishers of Healthcare Design, providing expert insight into the design, architecture, and engineering of healthcare environments. Online, in print, and in person. HCD TV.
Jane, can you tell us a little bit about yourself, your organization, and why you choose to attend the HCD conference?
I have an interior architecture firm that for 38 years has specialized in healthcare design, located in San Diego. And I've come to this conference every year. To begin with, I'm on the board of the Center for Health Design, which is one reason. But more than that, it's really the major conference. There is no other place that one can find so many attendees, something like 3,500. You'll run into everybody you've ever worked with on a project. I mean, it truly is amazing. And clients as well. And it's such a rich environment. It's incredible. And that's what we have in our exhibit space, because we have hundreds of exhibitors. And you're going to find all the big healthcare manufacturers who are going to save their new introductions for this conference because they have access to the top healthcare architects and interior designers.
Jane, your area of specialty is evidence-based design. Can you tell us a little bit about that topic?
Yes, I actually wrote the first book on evidence-based design, published in 2008 by the Center for Health Design. And when I think back of how little we design professionals knew in 2007 when I actually did the writing of it, compared to now, there has been this giant leap of knowledge. And I don't think there's anybody, or very few people I would say, who doubt that evidence-based design is here to stay and are implementing major features in virtually every new hospital. So it's a work in progress and will be forever. But the reason that I wrote the book is interesting. It started out in 2007 when, in a brief period, I had visited 3 brand new hospitals that had been touted as total healing environments. And prior to evidence-based design, actually that's what existed in terms of research-based design. It was healing environments, all with the common thread of reducing stress. And it evolved into this very huge body of research now called evidence-based design. It's a very simple explanation. But under the area of healing environments, hospitals had gone from the 70s, when they were very lacking in color and texture, and they were really what everybody called institutional environments. And then we had Plaintree Model Hospital Project that came along in 1983 and changed many things and put the patient at the center of the universe, and everything was viewed through the patient's eyes. And hospital environments, really, there were very few then that were white and sterile and stark. And now, I don't know how to explain this actually, because I'm seeing so many of our newer hospitals being opening, and they're just stark. They're white. They're white on white with sometimes ivory accents. I mean, they're just, and the design in the lobby may be very nice and richly detailed, but when you leave the lobby, sometimes there's an abrupt cutoff, and now you have no design detail at all. So you leave the lobby and you've got all this nice design, and then you walk to areas where the patients really spend their time, which is certainly not the lobby. It's in the patient rooms, the nursing units, the diagnostic imaging treatment spaces. And what you have is these very institutional environments. Not only do they lack color, but they lack any design detailing. There's no wood trim, no nice lighting. You have 2x4 fluorescent light fixtures overhead with patients on gurneys, all these things that we know better. We know not to do that. And I thought, what is going on here? I don't understand it. And so the book then became a manifesto about this topic. and a polemic about it. And then as I started to do research, I contacted most of the major healthcare architecture firms that do such good work. And I asked them to send me examples, good examples of not public spaces, but areas where patients spend their time. And I said, send me areas that have, that truly are healing environments. And so I started gathering these projects, and then my goal was to annotate that, to show how evidence-based design was put into these projects. And so the book took a very different path then. And as I started to research a topic, I kept discovering one thing after another that was just absolutely fascinating. For example, a client called me one day and said, we just had a survey and they cited us for the fabric that is on a patient chair, because they said it could support Clostridium difficile and it could stay there for 5 months. I said, what? So I called a lot of designers that have been working in this field for a long time. I called so many people and I said, have you ever heard of this? And they said, no, we've never heard of this. So I thought, whoa, I'm onto something here. So then I called some physicians, very prominent physicians that I know from our board of directors, and I said, what is this Clostridium difficile and what are MRSA, and tell me about this. And so I started to peel away the layers of the onion, and I went to the CDC's website, and there are so many professional organizations for epidemiologists, for example. And I remember one night I was up till 3 in the morning on the computer because I just couldn't stop. It was just voracious, and I started learning so many fascinating things about infections, and I realized that if I don't know it, and I've been doing this for 38 years, there's a lot of design professionals who don't know this, and I realized that now our charge needs to be to keep patients safe. More than anything else, we as design professionals have to help hospitals keep patients safe. And so the book then went in many different paths, and it was a fascinating journey for me. But I still, in the end, have this question about why we're seeing so many planned hospitals. It's not a matter of money. It's a matter of attitude. And, perhaps I'll close by saying that what I think is the next frontier is an application of neuroscience and understanding. I don't think design professionals really understand that the aesthetics are not just something that decorates the building, that neuroscientists tell us that the brain actually, by default, reacts to visual stimuli in the environment. So whether we provide all white or something with robust color or something in between, it's having an impact on that patient whether you realize it or not. And the brain is sending more stress hormones. Cortisol, for example, is one that actually impairs wound healing. The research associated with each one of these things is just fascinating when you read the individual studies. So I think that's really the next frontier. People are starting to work in that area. The AIA about 8 years ago kicked off a research project called Neuroscience and Architecture, but it's been moving in a slightly different direction and not really focusing on what's going on in a person's brain as a response to some of these environments we're creating. So that's what I hope will be next. The magazine is astonishing, and I remember it from the very early days. Because I've been doing this and writing, I've written 6 books already, and so I pay attention to all these things. And prior to Healthcare Design magazine, we had no way of seeing healthcare projects. All you could see was maybe half a dozen a year that would be maybe an architectural record in one specific issue, or contract magazine, or interior design. And most of those, by my criteria of what I know about healing environments, many of them, they may have looked good to an editor who didn't understand healing environments, but they were often pretty miserable healthcare environments functionally. And so here now you have this magazine for this number of years that is nothing but healthcare design. what that has meant to this industry, you cannot put a price on it. It's just in quickly, rapidly disseminating ideas about a specific project, a specific room layout. There's a very thoughtful article about research for patient room in this November issue. You know, how would you get that information out without a magazine like that? And then there's the Herd Journal, which Vendome publishes, and the research in there is simply, it's incredible, absolutely amazing. I just reviewed about the last 6 issues because of the board meeting coming up this afternoon, and you know, the two together have done so much for this industry. You couldn't put a price on it.
Well, Jane, we want to thank you for joining us on our inaugural pilot episode of HCD TV. We wish you continued success. Enjoy the rest of the conference, and thank you for joining us.
Thank you. My pleasure.
HCD TV, from the publishers of Healthcare Design, providing expert insight into the design, architecture, and engineering of healthcare environments. Online, in print, and in person. HCD TV.